You want to know the best exercise to do after you've had a total knee replacement?
Or our favorites anyway.
Okay, this isn't evidence-based. This is our favorites, what we tell our patients that we think is the best. And actually, they're different.
They are different. I like that.
I'm Dr. Paul Zalzo.
I'm Dr. Brad Winning. Welcome to Talking with Docs.
Okay.
So after you have your knee done, a critical part of success is the physiotherapy.
Because stiffness is one of the most common complications to experience after a total knee replacement. Range of motion is one of the most important things to get so that you have a good outcome, so that your mobility is optimized.
And I would go one step further to say that stiffness is one of the hardest things to solve. Once you get stiff, it's very difficult to get unstiff. So we always prefer just for it to never happen to not talk about. And most people do okay. There are very standard protocols that most physiotherapy clinics or hospitals are going to have. They're going to teach you, and everybody does okay with those exercises.
And 100% of the time, in my opinion, you need the help of a physiotherapist or a physical therapist.
Yes.
And that's not someone coming to your house. You have to go to the physical therapy place or the physiotherapy place and do the exercise under their guidance.
No shade to home physiotherapists, because there's going to be some comments about people that use home physio and are happy, as well as therapists that go to people's homes. The only reason we say this is that typically it's good to get out of the house. It's good to have a routine. And the hospitals in Ontario see the lion's share of the joint replacement patients.
The role for home physiotherapy is huge. I mean, I think it's great. Just after total knee replacement, in my opinion, home physiotherapy is not the way to go.
Right. So usually at the 2-week follow-up, I'm seeing people for pain control, make sure they don't have a blood clot, make sure they don't have infection, make sure their range is okay.
And take out the clips.
Take out the clips. But if they have a stiff knee, usually during the clinic, this is the one. I have one exercise that I usually demonstrate for them and say, listen, I think you need to start doing this because this can help you maybe get over that hump.
Okay. Well, let's go look.
Okay, we'll show my number one and then his number one.
Okay. Okay, Dr. Weeding, show us your favorite exercise to do after total knee replacement.
Okay, so this is my number one for a stiff knee. So I tell people get a chair that does not have wheels. Put it near the wall. So you get into the chair.
What if your house doesn't have walls?
You need to find a house that has walls. So first, when you're sitting down, have the chair that's relatively low. You can see that my knees are bent maybe 75 or 80 degrees. So this is an inadequate range for success after a total knee replacement. But what I'm doing then is telling people, use your arms and your body weight to start bending your knee. So you slowly move forward, and this really, really hurts. So now you can see I'm bent 95, maybe 100 degrees. This is the point where agony sets in. I tell people, hold it for 20 or 30 seconds as long as you can, and then go back in the chair. And again, you can use your body weight in your arms. You take a rest. And then you do it again. And if you want to go further, you move the chair a little closer to the wall. And then now I slide forward just so my butt is on the edge of the seat. Now I'm bending 105, 110 degrees. You can even put your head against the wall and cry if that's required. And then put it back. And this way, you don't have to involve your partner, because often partners are asked to push on the leg, and that potentially can be dangerous as well as cause some strife for your relationship. You don't have to get them involved. You can be responsible yourself. And you don't have to require your muscle strength to try to pull that leg back, because often the muscles are very sore. So medicate before you do it. Do this at home. Do it as many times as you can tolerate. That's my number one.
I like that one because it's self-directed.
Yep.
You don't need someone else doing it. And it matches our motto. You are in charge of your own health. So you got to do this yourself. Okay, let me show you mine.
Okay.
Mine also uses a chair.
Wow. You're so extra.
All right. So if you have a home without walls, you can do mine. You don't need a wall. You probably don't have a roof if you have a home without walls. So I say sit in a chair, and let's say your leg's out stiff. Let's say the right knee is the replaced knee, okay? You take your other leg, hook it around the front, and pull back, and pull back, and pull back. And then hold it there for a sec, and pull back until you cannot possibly pull it back anymore no matter what. Then pull it back a little more, And hold it there as long as you can, then let it out and let it relax.
I like that one.
Take a few minutes, breather, and then hook it and do it again. Pull back, pull back, pull back. So you're basically using the hamstrings of your unoperated side to stretch out the quads of your operated side. It's like robbing Peter to pay Paul, which I'm often a fan of.
I like that one too. Get that other leg involved, and often people are using that leg to move it around, get it in and out of bed anyway, so you can put it into the physio.
Again, you don't need someone helping you do that. You can do it yourself because you are in charge of your own health, and you are in charge of how good your outcome is after your total knee replacement.
Now you know. If you like this video, please like it, subscribe to our channel.
And if you have any cool exercises that you did after your knee replacement, put them in the comments so other people can benefit from them as well. Now, these aren't the only exercises to
No.
do. There's a bunch of exercises to do, and the physical therapist or physiotherapist is going to help you. These just happen to be our favorites.
There you go. We'll see you next time.